of the pericardium. Outside this parietal layer there is a tough fibrous layer. There is a tough fibrous layer of the fibrous pericardium, and this is adherent to the parietal layer of the pericardium, and so these are the coverings of the pericardium. Listen again. The outer surface of the heart is having a layer of delicate connective tissue, serous pericardium. This is known as visceral layer of serous pericardium. Outside the visceral layer there is parietal layer of the serous pericardium, and there is a potential space between the visceral and parietal layer, which is filled by a serous fluid, slippery fluid, allow the heart to pump and move and make the movements of the heart more smooth. When there is accumulation of fluid inside this pericardial cavity or pericardial sac, this condition is known as the cardiac tamponade. Cardiac tamponade. The accumulation of fluid in this pericardial cavity lying between the visceral and parietal layer of the pericardium is known as cardiac tamponade, and aspiration or drainage of extra fluid or infectory fluid is known as cardiac tap, and the outermost layer is tough fibrous sheath known as the fibrous pericardium. So this outermost layer is the fibrous pericardium. During development there is outermost layer, that is fibrous pericardium, and here is the balloon like serous pericardium. The developing heart indent this serous sac, and stepwise it will enlarge and occupy the pericardial cavity, and this layer which is here will be like this, and this will form the parietal layer, and this will form the visceral layer of the serous pericardium, and this is the fibrous pericardium. So heart is covered by 3 layers. Heart itself having 3 layers. The visceral layer of serous pericardium is known as the epicardium. The middle layer formed by the cardiac muscles is known as the myocardium. This is the most important layer and having this significant role in pumping of heart is known as myocardium. And the innermost endothelial layer and the subendothelial connective tissue layer of heart is known as endocardium. The innermost covering of the wall chamber and the subendothelial connective tissue are forming the endocardium. So heart is having three layers in its wall chamber. The outermost layer, which is formed by the visceral layer of serous pericardium, is known as the epicardium. The walls of the all chambers, especially the ventricles, is known as the myocardium, and the innermost endothelial layer is known as endocardium with its subendothelial connective tissue. So heart is having three coverings outside and it is having three coverings in its walls. So heart is having right atrium, right ventricle, left atrium and the left ventricle. Heart is having an apex and a base and three surfaces and four borders. So heart is having an apex, base. The apex of the heart is directed towards the left and inferior part of the heart and it is formed by the left ventricle. So apex of the heart is formed by the left ventricle and it is directed towards the left and inferior part of the heart. The base, or I can say the posterior surface of the heart, if I count the base as posterior surface, then heart is having four surfaces, but the heart is having three surfaces and the fourth surface is the base. The base is not the dependent part of the heart, but it is lying opposite to the apex, so it is known as the base, and the base is formed by the left atrium, which is lying in the posterior part of the heart. So this is formed by the left atrium. Atrium means ante-chamber, that is chamber before the chamber, and this is lying opposite to T5 to T8 vertebrae in supine position, but it descends by one segment during erect posture. So in supine it is opposite to the T5 to T8 vertebrae, and in erect posture when the person stands from the supine position, heart will descend by the one vertebra and the level will be T6 to T9. The structure behind this base or the left atrium is the esophagus and the descending aorta. So the structure, these are the vertebrae, and here is the base of the heart formed by the left atrium, and here is the aorta and the esophagus. Which are separated from the left atrium by the oblique sinus of the heart. The reflection of the serous layer of the pericardium, when it reflects from the great vessels, it is forming these sinuses. So the oblique sinus separate the left atrium from the descending aorta and the esophagus, and in conditions where the enlargement of the left atrium occurs, it will indent the esophagus and it will lead to the dysphagia, and this condition is known as Ortolini syndrome. Ortolini syndrome. So the indentation of the esophagus by the enlarged left atrium will lead to dysphagia, and this condition is known as Ortolini syndrome. So heart is having an apex, a base. Apex is formed by the left ventricle, and base is, that is the posterior surface, is formed by the left atrium. The three surfaces of the heart are the anterior surface. This is the anterior surface of the heart, and it is lying just behind the sternum in the middle mediastinum, and this is formed by the right atrium, right ventricle, and a small contribution from the left ventricle. The right ventricle is lying in the posterior part of the heart, so it is not visible in the anterior surface or the sternocostal surface. Anterior surface is also known as sternocostal surface. Anterior surface, also known as sternocostal surface, and it is formed by the right atrium and right ventricle, and small contribution from the left ventricle. The surface which is inferior is also known as the diaphragmatic surface. So second surface is diaphragmatic surface. Or the inferior surface. This inferior or diaphragmatic surface is formed mainly by the left ventricle, and it is having the posterior interventricular sulcus, or it is having the posterior interventricular groove, which indicate the interventricular septum. So the inferior or diaphragmatic surface, which is lying on the central tendon of the diaphragm, and it is having the posterior interventricular sulcus, and right 2/3, left 2/3 is formed by the left ventricle, and the 1/3 part of this inferior or diaphragmatic surface is formed by the right ventricle. So 2/3 is formed by the left ventricle and remaining 1/3 is formed by the right ventricle. So first surface is the anterior surface or sternocostal surface, and second is the diaphragmatic surface or the inferior surface of the heart. The third surface is also known as the left surface or the pulmonary surface. The third surface is the left or the pulmonary surface, and it is formed by the left ventricle. It is formed by the left ventricle and it is lying in the pulmonary nodes of the left lung. A small part of the left surface is also formed by the left auricle. Two ventricles are having the ear-shaped, external ear-shaped muscular structure or appendages known as the right and left auricles. Besides apex, base and three surfaces, it is also having four borders. Heart is having four borders: right border, inferior border, left border and the superior border. But these are